Hello and welcome to the NewsX Sunday Guardian Roundtable. We're again taking a look at the ongoing COVID cases in our country. For this is something that is still going on despite the new year, despite all our precautions. We have the Omicron coming. We have, of course, lockdowns and some kind of shutdowns happening. Are the cases still rising? Because even as we speak, there have been the country has recorded 264,000 cases and about 300 deaths yesterday. That's what we've been told. But we are told that the cases are supposed to be mild. How mild are they? What medicines are working? Have new medicines been discovered? So joining me to discuss all this is a panel of experts. I am joined by Professor Dr. G.C. Khilnani from Chairman PSRI, sorry. Dr. Harsh Mahajan, he is the founder and of Mahajan Imaging and Chief Radiologist. And Dr. Romel Tikku, he is Director at Max Internal Medicine. Dr. Khilnani, what is the current situation? आपको क्या लगता है? Should we be worried? Are the cases going to peak and plateau in a bit? How long are we looking at where Omicron is concerned?
So we may not be worried, but we should be concerned because number one, that when we should not presume that everything is Omicron, and also we need to learn from the United States and United Kingdom where the deaths are still going on at the same rate. Another thing is that if the 264,000 cases are diagnosed and published, actual number is much, much higher. Because not everyone is being tested. There's a large number of asymptomatic people who are positive pre-operatively or for travel or whatever reason. And people have gone into complacency mode in the sense that if one person is having fever, fourth person is having fever, they are not testing. And then home testings are not being recorded. So actual number is much higher. Now, if you take the studies from South Africa, from where this variant has started, and this is a published study in Journal of American Medical Association, where they have seen 2.7% deaths in people who came to the emergency, and as many as 17% required oxygenation, and 31% had actually had respiratory failure. So, and they were at the peak of Omicron wave. So, by sheer numbers, now if you take United States, if they have 8 lakh cases, and if you extrapolate to India, that becomes 40 lakhs a day. And actually, we are heading towards that. If you see, every day there is 20 to 25% rise in cases all over the India. I'm not scaring, but I'm cautioning that unless we take corrective measures, if you talk of Maharashtra, Mumbai, people are still getting admitted in ICU. People are on ventilator. There are deaths being reported. If the numbers keeps on rising at this rate, then we may be in a trouble. Other thing which is happening is that healthcare workers in a hospital like my hospital, which is 200 bedded, yesterday there were 73 healthcare workers who were off work because of the COVID infection. So there may come a situation where you won't have healthcare workers to look after the patients. Why I'm saying all this? That we may not worry, but concern should be there to control the transmission. And we should not forget the alpha wave, which were thought to be a mild cases and turned into havoc. So therefore, all precautions need to be taken. What is in our control is vaccination. What is in our control is minimizing the transmission. Variants are not in our control. More the infections, more the chances of new variants coming. I'll stop here and you can take the discussion forward. Thank you.
More the infection, more the worry of new variants, Dr. Tikku. That's something we'll take up later. But what is the situation on ground now? Are the cases, by when do we expect them to plateau? Do you have some kind of an estimation? Or we're still riding the peak?
Well, I think in Bombay, the cases are going down. In the last few days, it's already sort of reached a plateau a few days back. And even in Delhi, I think we've reached the peak or are somewhere there. In the next coming few days, I think the numbers might start going down in Delhi as well. But coming to numbers, it's all over the place. Even in India, if you look at more than 19 states are having more than 10,000 active cases. Now it's apart from Maharashtra and Delhi, It's Karnataka, it's Tamil Nadu, it's UP, it's Gujarat, it's Bengal. I mean, it's all over. But again, the positives are the disease continues to remain mild, as Dr. Kilnani said. But we should not dismiss it as a very mild strain, because all strains have the potential to cause severe disease and death. But if you look at the data globally, or even in India, the ones who are getting admitted with moderate to severe disease, or the ones who are in the ICU, not many of the Omicron patients actually need hospitalization, are the ones who are either not vaccinated or are partially vaccinated or have comorbidities, are elderly, or have other issues like transplant recipients, cancer patients. So the majority of patients who actually have moderate to severe disease or are needing hospitalization are these patients. And again, all the patients who are getting hospitalized, majority of them are not actually needing oxygen or steroids or ICU care. But having said that, looking at our population, there's every chance that the healthcare system will get stretched in time, because the numbers are still going up. If you look at Delhi, 28,000 odd cases, and overall in India, 2.5 lakh cases in the last 2 days. But if you ask me clinically, with my experience, I've been seeing patients virtually. Majority of them are getting better within 3-5 days. This particular variant has a very short incubation period. And the maximum infectivity is actually 2 days prior to actually becoming symptomatic, and for 3 days post you become. So it's roughly a period of 5 days. And most of them are clearing the virus within 5 days. That's why the isolation period has been reduced. And now UK has also reduced it to 5 days from 7 days. In India, we have an isolation of 7 days. But again, the infectivity can go on up to 10 days. So after 7 days, you still have to be careful. You still have to wear a mask. You still have to maintain a distance from elderly or the ones who have comorbidities. But overall, the picture looks good. To me, as of now, we are able to handle it, though the numbers are going up, and there's every chance that we might have trouble soon. But if you look at the treatment-wise, there's nothing new which has come up. Yes, molnupiravir, again, a lot of debate about its safety profile, and it can't be used in all patients. It's to be used in a very few patients who are having comorbidities, are elderly or immunocompromised. But otherwise, a majority of the patients just need paracetamol, or they need some symptomatic treatment, anti-allergic medication, and they're getting better. And the numbers are actually much, much, much higher. As Dr. Kilani said, that majority of the patients are doing rapid antigen tests. And if you have one patient in the family who's positive, you just assume that almost everyone will be positive, even though they might not have symptoms. So that's why all of them should quarantine. They should follow all the protocols. Otherwise, they'll keep spreading it. And that's how the disease spreads. Even globally, US is in a big mess. If you look at New York, the hospitalization rates, the death rates, even in Delhi, in this month itself, we've seen more deaths than we've seen in the last 6 months. So the potential of creating trouble will always be there, but we are handling it because not many people are having moderate to severe disease. And now we should focus on that chunk of the population which is not vaccinated. I think at least 20% of population still is not vaccinated. And if you look at the data globally and otherwise also even in India, they are the ones who are getting severe disease. They are the ones who are landing up in the ICU, and they're the ones who are getting trouble. So we should focus on vaccination. And apart from that, I've always said, wear a mask before you step out, because that's the most important thing. And otherwise, this virus has a potential to really cause a lot of devastation, as we saw in the previous wave, and a lot of healthcare workers getting infected. I think half the healthcare workers in all hospitals, whether it's the nurses, doctors, are getting infected. And that is something to worry about. And it's a huge challenge. If your caregivers get infected, then obviously the patients will also suffer at some point.
You are one person who's always, said that don't let up on the testing. Also, you said vaccinations and testing. But now we are seeing that a lot of countries, whether it's Spain or UK, have said that, they are doing away with so much of mandatory testing, because like Omicron is something that people will get. They kind of, they're treating it like it's not, it's treat yourself when you're symptomatic rather than just doing the testing. Anji.
Thank you. Well, in the initial phase of any wave, it is important to stop infections coming into a country. And that's where, just as India did and many other countries, international travelers were subjected to these tests as they were coming in. But as the disease, despite all the measures that you take, as the disease spreads in the community and there's community transmission, then you don't really follow the same norms of testing. And that's what the UK today has done, a few days ago has done, where it says that even for those coming in, there's no need for a RT-PCR test to be done 24 hours prior, as long as they are vaccinated. So vaccination has become a kind of, a method of segregating those who may be infected from those who may not be. And even in our country, as this virus starts rampaging, we have to prioritize those who get tested done. Number one are those who are symptomatic, because they have symptoms. They are the ones who should go and get tested immediately. Then number two are those who've come in contact with positive people and are at high risk of getting a serious disease, that is 60 years plus, or those of any age with comorbidities. They come next in the hierarchy of those getting tested. And then may come those contacts who, may be asymptomatic. In fact, the government has said that, as an advisory, that the asymptomatic contacts who are healthy and who are below 60 years of age need not even be tested, as long as after they come in contact, they isolate themselves, they quarantine themselves, and if they get symptoms, then they go and test. So we saw in the Delta wave that there were long lines. Our testing systems got overwhelmed, and people who deserved to get the test done were not able to get it. These symptomatic and sick people were not able to get the test done because we were getting tests done for interstate travel and so on and so forth. Even now, international travel where the incoming country wants a test done, that is still permitted. But otherwise, only those who deserve it should get a test done, because our capacity within the country is finite, maybe about 2.5 million tests a day.
Hello and welcome back to the NewsX Sunday Guardian Roundtable. We are here discussing, Omicron and how long will it stay, the symptoms, the medications, the treatment. And Dr. Khilani, I want to ask you, is it anecdotal evidence? But a lot of people who had Delta are getting Omicron also. I thought that, that would make them more antibodies. But a lot of people we know they're very surprised because they thought that would have protected them. But why is that?
Two reasons. One is that we know from the studies which are done that immunity to COVID infection as well as vaccination wanes over a period of time.
Oh.
The initial euphoria of United States of vaccinating people and walking with a mask went away because people started getting infection despite being vaccinated. As the antibodies were tested, we came to know that in 5 to 6 months' time, that antibody level goes down significantly. Israel came out with the data that after 4 to 5 months or even 3 months after the vaccination, and they received mRNA vaccine, the infection rate started occurring again. And they also realized if the 3 months after that infection was less, 4 months it was much more, and then 5 months more. So as the time passes, the immunity to fresh infection goes down. Other thing which we are seeing now, and which was seen in Israel also, that if you ask me, whatever patients I have seen in these days who are RT-PCR positive, which is pretty large number, only one patient was not vaccinated. And several of them actually have had infection during first or second wave, has got infection again. It does not mean that vaccination doesn't protect us, or the infection does not protect us. Both infection as well as the vaccination gives us a protection against the severity of disease and death. And this is not only in India, in the United States, 1,000 people are dying every day. And yesterday a report came in the New York Times that majority of these deaths are the people who are unvaccinated, which are 25% of the US population. So what I'm saying that nobody should think that just because he has had an infection during first or second wave, he is immune to the infection. Nobody should think just because he is fully vaccinated, he will not get infection. But he should also realize that since he has been vaccinated or infected, he is likely to have very mild disease. Other thing I want to say that it's probably not correct to presume that everybody who is coming with COVID positive has got Omicron. And Delta is still around the world, and no, and whatever the data has been there from India, the gene sequencing, the Omicron has been to the tune of say 80%, 84%, at best 86%, as has been come out. So other variants, there is a probability of other variants being there, and it's not that patients are not in the ICU. There are two types of patients in the ICU. One, those are because of the COVID severity that they are in the ICU. There are some people in the ICU, they are not because of the Omicron, but they are with the COVID, because they have some other severe disease and they are positive, so they are in the COVID ICU. Thankfully, the northern India, especially Delhi, if I can commit, and as Dr. Tikku has really rightly pointed out, so far we have had very mild cases, but that's not true of Maharashtra. That's not true of other states. We are still having 300 deaths every day. So therefore, having had infection before and having had vaccination gives us protection against the severity of disease, but infections are possible. Thank you.
The pediatric rate, how are the children handling COVID? Are you getting a lot of cases? Are they mild? Are they serious cases? And secondly, when can we say that this is endemic? When can, a lot of countries, Spain, I think, is toying with the idea of saying, let's live with COVID.
Well, as we all know, in children, the disease is most of the times mild and doesn't cause severe disease in majority of children. And that's the way it is right now. Even with Omicron, which anyway is less virulent, the children are not having too many issues and not many hospitalizations happening in the pediatric age group. The problems are more in the elderly and the ones who are vulnerable with comorbidities. So I would say, by and large, it's behaving the way it was with children and is pretty mild. On the other hand, coming to your other question, when do we become endemic? Well, it will happen over a period of time. It only happens when majority, at least 80% of the population, is either naturally infected or vaccinated. But that's going to take another few months, I guess, or at least a year maybe, because there's a huge chunk of population still which is unvaccinated. And with the threat of these variants, we've had the Delta, now Omicron. We don't know what is in store for us in the coming few months. There might be another variant which has multiple mutations, might be more transmissible, might be more virulent, for all you know. So there's a long way to go as far as endemicity is concerned. But it seems like the way it's going, the virus is also becoming weaker by the day. And hopefully in the coming few months, I would say by the end of February, the Omicron will be able to get rid of that in India. But till then, we'll have to cope with it. And in the future, you never know which other variant might come. So we have to be on guard. We can't get complacent, especially if we look at the overall global data with Europe, UK, and US, the kind of problems that they are facing, their healthcare workers getting infected, the system getting overwhelmed. It can happen to us as well. So till then, we have to live with the mask. We have to have these restrictions in place, because this virus has the potential to create more and more mutants in the future. It's only time which will tell us when it will become endemic in India. I think there's a long way to go. Maybe another 1 year, we'll have to deal with it. At least this 2022, we'll have to live with it.
Every December we say, is it January? We say end of the year, then we say, oh, maybe another year. So there's no end in sight. But Dr. Mahajan, the genome sequencing, do you see, any feedback? What have you heard? Is it Delta still prevalent? How much is it? And do you see the mutation happening? Any update on that?
Well, there are no fresh mutations. Omicron, of course, is there. And the Delta, the data is still sketchy. But it seems that, as Dr. Kilnani said, about 85 to 90% of all infections would be due to Omicron. It may even be more, because it has actually taken over very, very quickly. Delta was with us right from June, July, and we were numbering very, very few cases. less than 10,000. And suddenly we've had this explosion. And this has to do with Omicron. Now, as regards, being able to tell the difference between Delta and Omicron on RT-PCR, yes, there is a kit that has been developed by Tata along with ICMR, which would be positively able to pick up Omicron cases on RT-PCR. Otherwise, right now, there is an imported kit which has a S gene target failure. So S gene is missing in Omicron, which is there in the Delta variant. And this RT-PCR kit is able to tell the difference. But genome sequencing, I think we need to continue to do that in large numbers. It may not be so much to identify Omicron as to determining and finding out whether Omicron is mutating into something different. Because remember, the larger the number of infected people, the larger the number of viral replications, and the higher the chance of a mutation. And one of these mutations may become a virus of concern in the weeks and months to come. So I think our genome sequencing has to be kept high at a high level. And as and when the other kits come in, especially Omnishore, which is the new kit indigenously developed for Omicron, we should start using that.
Professor Kilani, a lot of people are complaining of excessive fatigue. Not everybody, but that seems to be, that was there in Delta also, and I'm hearing in Omicron also. Is that something to worry about? Or, is this the long COVID part of that in Omicron also?
So I must describe some bit of my experience during last fortnight that I have seen the patients with. They generally come with scratchy throat and running nose or stuffy nose, with a little bit of feeling chill in their body, slight diminution in appetite, little bit of headache. All may not have all the symptoms. Some may have a few. Some just complain of even backache or feeling slightly unwell. And you test them, and I'm not disappointed that quite a few of them become positive. But thankfully, some few things are not seen. And the experiments have shown that this particular variant does not involve lung and does not cause pneumonia. That is one. Loss of smell and taste is also not there. Now, it's a very devastating symptom, but actually it exemplifies nervous involvement, neurological involvement. So I believe that because of this absence of loss of smell and taste, the neurological complications will not be there, like brain fog or strokes. We haven't seen any cardiac events with this. And fatigue, of course, is there. Fatigue is there, general weakness there, which is seen with any viral infection or common cold, you might call it. But absence of all these things and short period of illness. And majority of people are recovering on third or fourth day with analgesics or paracetamol. So I envisage with my clinical this thing that the long COVID will not be like what we saw during first and second day. And now some people are saying that this is a something blessing in disguise, that there is a evidence that Omicron gives a robust overall immunity against COVID. That is actually a silver lining in this infection. Not that everybody should get infected, but it is giving a good immunity. And other thing is that third dose or booster dose or precautionary dose, those who have received 2 dosages have very little immunity against Omicron. However, those who have 3, what I'm talking is the published data, not from those who had 3 dosages had 25 times more immunity against Omicron. So there's a need for enhancing and speeding up with the precautionary or third dose in our country. And nobody should think that mRNA vaccines are superior vaccines than Astra vaccine or Covaxin. Our vaccines are pretty good with the high quality and safety profile. Thank you.
Dr. Tikku, the comparison with Omicron and do you see Omicron now as what Delta was earlier before the variant come in? Or is it not as serious as the original Delta?
Well, not really. Omicron seems to be pretty mild. If we look at the kind of patients that we've been seeing in the last fortnight or so, majority of the patients, 80 to 90%, are either asymptomatic or have mild disease. Now, if you look at the previous wave, which we have in April, May, the Delta was devastating. Almost.
Preceding that, the beginning of the COVID.
It wasn't that, but Delta was the worst, I would say. The first wave wasn't that bad, but we did see lung involvement. We saw a lot of patients needing hospitalization, though the system did not get overwhelmed or stressed because it wasn't as bad as the Delta variant. When we went to the second wave, it was pretty bad because a lot of patients, I think 60 to 70% were needing hospitalization. Out of those, majority landed up in the ICU, needed steroids, oxygen, or maybe BiPAP or ventilatory support as well. But if you look at the Omicron, it's in contrast with Delta. Majority of the patients are actually getting better on their own with symptomatic treatment. And there is no panic now in patients. See, earlier I would get about 100, 200 calls in a day, though the numbers are almost similar. Now I get 50, 60 calls in a day. So I can figure out, I used to do more than 50, 70 consults a day. I'm doing 30, 40 now, even though the numbers are still the same. So people are not panicking. They don't keep calling you because they don't get those symptoms. In 3-4 days, they've also realized now. And we also keep reassuring them that they're going to get better in 3-4 days. So the panic is much lesser. And they've realized that they're getting better. One person in the family gets infected. The rest of them follow the same advice and they're also getting better. So that way, Omicron is a blessing in the sense that, see, all of us will get it at some point of time. That's what I think. And maybe that's the way that we'll reach endemicity at some point. So Omicron, that way, is not bad at all. But again, if you bring it to your home and if you have vulnerable patients at home, the transplant recipients, the cancer patients, diabetic patients, then they might be in trouble. Because even if you look at the data right now, this is the population which is landing in the hospital or needing ICU care or needing steroids or oxygen, though much lesser compared to the Delta. So take care of the vulnerable population.
Okay. On that note, thank you so much for joining us and telling us what is happening on the ground, since all of you are there facing it. And take care, and we'll talk again next week and keep touch on the situation. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.